Greetings!
Salutations and welcome to Thinks with Shrinks.
Thinks with Shrinks is a mental health Zoomcast where psychologists share information on various topics and explore what's actually on the minds of Dartmouth students. We're your hosts. I'm Dr. Alex Lenzen.
And I'm Dr. MK Oakley. On today's episode, we'll be discussing how primary care services support mental health needs. And we'll be joined by our guests from downstairs in primary care, Mary Lee Verdi, Holly Cathcart, and Barb Homier for this. I'm looking forward to interesting conversation. Plus, they have promised to give us all a glimpse into the COVID testing process for when students return to campus. So stay tuned. But first, Alex, should we begin with today's big green gremlin?
Yes, we should. Let's get that hairy guy going. So today's big green gremlin comes from at Fly2High9, and they shared, I was handling the changes associated with the pandemic pretty well at the beginning, but I've been struggling more recently with feeling sad and having no energy. Is this just me?
No for a third time, because I think, you're describing sort of, unfortunately at this point, a very universal experience. And first, good job handling the anxiety well at the outset. I think at the risk of sounding like a broken record, my immediate reaction to this big green gremlin is self-compassion, radical acceptance, know that we're all in this sort of doing the best that we can, and with sadness and feelings of low energy, just control the things that you can control, and practice, again, patience and self-compassion. Alex, anything to add to that? I do feel like we just reiterate this theme.
This self-compassion is the cure for a lot of things, so I think it makes sense. But I guess one thing I'll add is that likely through this process of managing feelings associated with the pandemic, you have noticed that your ups and downs have looked different from other people's, and that's normal, right? Like, we react to different things in different ways. Some people might have really struggled at the beginning of the pandemic, and now they feel like they've gotten into a groove and kind of know what to expect and how to handle things. And other people might have that reverse experience. I think I actually fit in the camp more with this Fly2High, because at the beginning I was a little bit in like crisis management mode, like this is scary but exciting in this way that I can do something, I can act, I can help people find their way through this. And now I think the exhaustion has worn on, and I'm feeling too more low energy, and having just my emotional bandwidth is a little less wide.
Right. Yeah. We're not hardwired to stay in that state of physiological and cognitive arousal. And so I think what you just described makes perfect sense. It's, we activate and sort of mobilize when necessary, but we can't expect anybody to stay in that state for that long.
Yeah, absolutely. So you're not alone, and thank you, Fly2High. For the rest of you listening, remember, if you want to be featured on a future episode of Thinks with Shrinks, post using hashtag Big Green Gremlin on Instagram to share a worry or concern that you'd like the Shrinks to discuss.
Great. And with that, we'll get into today's knowledge drop. And again, we're going to be pretty brief during this part so that we can really spend the majority of the episode hearing from our guests. And Alex, do you sort of want to set the frame for us?
Yeah, absolutely. So we've talked before about the importance for us of interdisciplinary collaboration. I think it was when Shira was on with us talking about nutrition that we first elaborated on this. And one of the offices that we frequently collaborate with is our primary care office. As you've referenced, normally downstairs. I'm not currently in our building. We're on the second and third floors, but primary care is on floor 1. And I think these are the people who students commonly think of when they hear health services or Dick's House. Their staff consists of a whole bunch of people: physicians, physician's assistants, nurse practitioners, nurses, medical assistants, radiology technicians. Basically, it's a mouthful, for they do all sorts of medical services.
Yeah. Wow. Good memory, Alex, unless you wrote that down.
I'll never tell.
Yeah, no, I'm sure that you have that upstairs. So you may be asking yourself, okay, so what do all these sort of medical professions have to do with mental health and mental health care? And so I think it's useful to just take a step back and remember our bodies and our minds are so interconnected. And so things that are going on with our bodies often sort of show up as manifestations of mental health symptoms and vice versa. And so one of my favorite quotes that shout out to my advisor from grad school, he always used to say, to change a thought, move a muscle. And I think that hits home how, sometimes it can be hard to tease out what is sort of going on and playing out in our minds and might feel more like an anxious or depressive symptom versus what's going on in our body. Is it the flu, or is it sort of normal butterflies or abnormal butterflies? And would it be worth talking to a mental health provider or a physical health provider? I think one of the benefits of Dick's House is that we have the resources and the personnel to be able to get into the weeds and dig into that, because we can cover the spectrum and the overlap of where mental and physical health are interrelated. And the second piece of why I'm excited to sort of bring our guests on today is that we overlap with patients. And so as hopefully they'll discuss and flesh out the process for us more formally, for students who are on psychiatric medication, often, that is managed and prescribed through primary care. And so there's this element of sort of direct support. And in the spirit of collaboration and interdisciplinary care, I think it's awesome that we're going to have this opportunity to sort of, swap ideas and share some, hopefully, some good anecdotes and things like that. Anyway, let's not waste any more time. Let's go ahead. Let's bring on our guests.
Hello, everyone. Welcome to Thinks with Shrinks. Thank you so much for being here with us today. I guess if you could each start by introducing yourself to our audience. And Holly, let's start with you.
Hi, I'm Holly Cathcart. I'm one of the physician assistants at Dick's House at the Dartmouth College Health Service.
Mary Lee?
My name is Mary Lee. I'm a nurse practitioner at Dick's House at Health Services. My office is actually right next door to Holly's, and that's me.
Great, thank you.
And hi, I guess I'm next. I'm Barb Homeyer. I'm one of the physicians at Dick's House. I also do some teaching over at Geisel with the medical students and a variety of different other things.
Awesome. Thank you. And again, it's so great to have you with us today. As you know, the topic of the episode is the intersection between physical health and physical well-being and mental well-being. So before we sort of dovetail into the questions that I know you've seen, I would like to dig a little bit more into what it is that you all do on a daily basis. And so let's reverse the order. We'll start with Barb. And if you could just tell us, what's a typical day like in your life, or maybe what's something or an aspect of your job that maybe people don't think about when they think about, oh, I'm going to health services to see Barb, for example.
Yeah. So I actually mentioned my Geisel responsibilities because I float between the two. And I think not only with regard to mental health and us seeing individuals at Dick's House, but it's a large component of what we teach and engage with medical students about, to have them appreciate and learn and be open to and receptive to everyone that eventually they will be working with as a provider. And I think more and more, especially in the last 6 months, I feel, and it'll be interesting to hear what Holly and Mary Lee say, I would say almost everyone that I talk to, either on the phone, over Zoom, or in the office, or at the medical school, there is some element of anxiety, sadness, isolation, loneliness. And I feel like it's a really important part of what we do is being here to hear them.
Great, thank you. Mary Lee, what do you do?
What do I do?
Yeah, tell me what you do. I
do?
mean, what don't you do?
I don't know. What do I do every day? It's really everybody's going to come in and I want to know where they are. Bottom line, whether it's on Zoom, whether it's on the phone, whether it's here in the office, sitting in this beautiful window seat, it's, find out where they are emotionally, physically, and spiritually. And, because all of those things make such a difference in your well-being. And that's what kind of all of us are here to do, right? So yeah, people are sad. Some people are happy. Some people are great. And it's, I think as a team, and what I want to do is kind of, support all of the patients, the students, and being the best they can be, whether if they have a cold or whether they've stubbed their toe or whether their eyes are itchy from being on too many Zoom calls, so that's what I do. And then I go and I, visit everybody because that's fun, right?
And share your
Perfect.
chocolates.
Yeah, we all take advantage of Mary Lee's chocolate.
Oh, wait, I'm leaving. I'll be right back. Always have chocolates in my office. So even if you're not feeling good and you want to come by Dick's house for a chocolate, come on by.
Perfect. Well, now I know. and Holly, it's a tough act to follow, but
I know. So I have the distinct pleasure of working right next to Mary Lee. So on a usual day, every 30 minutes or so, I trot out of my office, past her office, chat, wave, grab some chocolate, stick it in my pocket, and then go out to the waiting room and introduce myself to whoever is coming in to see me. That's what we usually do, or we used to do. Go out to the waiting room, introduce ourselves, welcome students into the health service, show you to one of the quaint little exam rooms, and then, but these days, more often than not, we speak on the phone or Zoom. And we do that first to see if we can accomplish all of your needs via telemedicine, but then often students end up coming in anyway. So then we will have a follow-up visit or identify what needs to be done in person, and then students will come in. And then after my appointments, I chat with Mary Lee again and get another piece of chocolate. And that's pretty much my day every 30 minutes.
Rinse, repeat.
Great.
Well, thank you all. And I think it's helpful to hear a little bit about what that looks like. And I appreciate how you really all mentioned the ways our work overlaps and how you're looking at students kind of holistically. So we're going to ask a little bit more about medication specifically, but aside from that piece, you started to talk about this, but could you talk a little bit more about how the ways that mental health comes up in your work and what that looks like? And I guess, Holly, we'll kind of go in reverse order again. We'll keep switching back and forth. So Holly, we'll start with you.
Sure. So it seems like the vast majority of visits these days, there is some level of, I think it's just an opportunity to check in, whether you have an ingrown toenail or you think you have strep throat or you need a refill or you have made an appointment because specifically you want to chat about how you're managing your academics during the pandemic. I think it's a really good opportunity for primary care to just say, how are things going? And we're doing that in person. We're doing that over the phone. We're doing that via Zoom and even via secure message. I think many of us are just reaching out just to give people an opportunity to say how things are and to kind of take the temperature of the situation. And as Mary Lee said, we get a variety of responses. Everybody seems to be, we're all dealing with the world in a slightly different way than we were before. And some people are recognizing ways that that's making things easier in one facet of their life. But we're all being impacted. So I think that all of us in primary care are using all of these little check-in moments as opportunities to see how people are doing, and then to delve deeper into whether there needs to be some additional support there. So whether people are happy to just share here's what's going on while I'm living at home, or, this has been pretty hard and I feel like I'm not managing as well as I could. And then we can sort of talk about all of the more structured ways that we in primary care or in our referrals to counseling can kind of help to guide the student if necessary.
Awesome. That's helpful. Thank you. Barb or Mary Lee, anything to add to that?
I just, as far as, dealing with those things, it's about, a lot of times use the analogy of the toolbox. And we need, when things aren't going well, we use the metaphor of the toolbox of what do we have and what resources are available. And the resources our students have, there are quite a few, and I think we all work with the students in work with you guys and identifying, is it counseling? Would counseling help? What are your thoughts on medication? Have you ever been on medication before? Is that the right choice? Is that something worth talking about? Is it exercise? Is it nutrition? Is it sleep? Because every single one of those tools, one of those items can make a significant impact on your well-being. And it's kind of reviewing those and working together as a team.
Yeah, and I would, if I may, just add to that too. I think one of the beauties of working with the group of people that we work with here at Dix House is that we all have a similar belief in helping students have agency in their lives and giving them, I love the analogy of a toolbox. It's not only the physical resources, the medication resources, it's what do they have internally as a resource, and helping them learn and identify that. And, there are ways of doing that on campus, wellness center, counseling center, certainly can also help students with, like mindfulness. But I think this is a generation that is so highly motivated to achieve. And with that comes sort of the baggage of stress and anxiety. And how do we help them manage all of that? And I think it's something we all try to tap into.
Yeah, I love that. And I think, what's hopefully coming, it struck me and is probably striking our listeners as well, is this sense of team and camaraderie and this idea of sort of a shared perspective of both helping students find and rediscover, cultivate agency, but also I love the attention that you as primary medical providers put on this holistic approach to health and well-being, and so I think that is something that I wish I had. I don't know, Alex, if you as an undergrad, I always felt like counseling did the brain stuff, and primary care, they told you had mono or were pregnant, and that was sort of like the extent of that.
Both.
Right, but even in the way that you guys interact with one another, I think it's just such a nice reflection of that approach, and a very evolved approach it is. So on behalf of the students, thank you for the care that you are providing on a daily basis. And I know that we're going to talk specifically about medications, and this has come up on previous episodes, and it's always a really rich conversation. But could you, and everyone doesn't have to answer, but could you tell our listeners a bit about if someone were interested in psychiatric medication and their first step was not counseling, how does that look? Could you walk me through that process?
Sure. You want to take a thorough history. And getting to know the first point of every visit is getting to know the patient, getting to know the student and where they're coming from, what their motivations are and why they're there. Usually if someone is looking for medication, there's one of two concerns, and that would either be anxiety and or depression. They're really good friends, so you can't really separate anxiety and depression, they're buddies. So
they're like you and Holly.
Yeah.
I'm anxiety.
And I think an important history and explaining what medications do, because in the end, using another analogy, what we do in primary care, we're navigators, and the students are the captain of the ship. So they're the ones who are making the decisions. They're the ones who are steering the direction as to where they want to go. And it's our job to provide those directions and the tools in order for them to get there, and to really design it to meet the needs of where the student is. Some people don't want anybody to know they're on medications. There's still a lot of stress and anxiety around that. I think we all look at mental health medications and pharmacotherapy just as if we would look at medications for diabetes or high blood pressure, and that counseling and exercise and diet can help just as well as medication. And maybe you need to be on medication for a short period of time while you're getting the other things in order to kind of help you through a rough patch. Is that answering your question, or did you want to know specifically what medications we choose and why we choose them?
I mean, D, all of the above. I think that was a great intro. And if someone else wants to sort of segue and take on a little bit more about the logistical process, I know that often is something that comes up when we have students who are sort of like, well, why do I have to go there for meds? Why can't you do the meds? And so I think that just the more information we can give to streamline the process, the better.
So
Well,
we in primary care prescribe the medications. We often work really closely with counseling, in that a student has presented to the counseling center, and a clinician has said, if medication is what you're looking for, you may also want to talk with primary care. And sometimes the student wants us to be involved in a relationship where we get more information about what sorts of things they are most worried about, but it's not essential. So often we will have a student who presents for an appointment to discuss medication, having seen a counselor or a clinician, and then asked whether it is appropriate for them to start medication, and then they make their own appointment. So, and it can work either way, or they just make their own appointment and they come in and they say, this is what I've been thinking about. I think we often talk about, just as Mary Lee said, we sort of lay out the different options to help people feel like themselves. And I think in primary care, what we're looking for is to help people feel like themselves. And so when they are sharing concerns about anxiety or depression, they're noticing symptoms that are making them feel less like themselves. And so our goal is to get them to feel just like normal. And then we kind of talk about, like, our bread and butter in primary care are the medications that are in the selective serotonin reuptake inhibitor family. Those are things like Prozac, Lexapro, Zoloft. So that's sort of often, I think, where we start when we're talking about medications in primary care for depressive symptoms or symptoms of anxiety. And we talk through the ways that people might feel in the first week or weeks that they take their medication. And I think most of us like to check in again after a week or so. Sometimes people come in and they say, like, I just want to know what's out there. I'm not really sure. I'm not sure this is for me. So I would say maybe 50% of the time that first visit is like, here are the things that we can think about. And you can let me know if you're finding that if you get your sleep on track and you're able to do some of the other things in your life that restore you and make you feel like you, then great. If you feel like you need a medication to be able to access the strategies that you've used in the past to make you feel like you, or the other resources, then we can talk about that too. Sometimes I think people are, there's like a couple of hurdles because they're accessing healthcare on their own for the first time. So like being prescribed something, and then what do you do then? And so that's where Dick's House is really great. I once again trot out of my office and past Mary Lee's, and we walk out into the hallway, and we can show students whether or not they are considering medication or not. I think when they come in for the first time, it's nice to give a little bit of the health service has the counseling center, and it has x-ray, and it has primary care, and it has a pharmacy, and it has lab and
Sure thing.
vaccination clinics. It has an allergy clinic. Like, these are all of the things that are here in this building that you can access while you are a student. So it's a nice opportunity to then, if students are interested in continuing medication they've already been on, restarting medication that they stopped, or talking about whether a medication is right for them, we can also kind of work through, when you are here at Dartmouth, these are the places where we can help you access healthcare in all of those different realms.
And I would say it's a really great opportunity, just re-emphasizing what Holly and Marilee have said, of shared decision making. So I'm a pediatrician, and prior to College Health, most of my clinical work was really with little children and adolescents. But you're really working through a family. And when you work with a college student, they are of an age and intelligence and situation where it becomes a shared decision-making process, meaning we educate them, we hear from them, and then collectively decide what is going to be best for them. And I think it's important for incoming students to recognize that. It's a really lovely, wonderful process. And I also think important, just like any area, there are people, individuals, collectives that have greater expertise in one area than another. So we refer to counseling because you are the counselors. There are certain psychiatric medications, for instance, that I would not be necessarily comfortable prescribing because I'm not as, I haven't been exposed to them as much and just not as comfortable. And I would refer to one of our psychiatrists for that. So I think that's an important component to this idea of, well, why do I have to go here and here? It's because we're all giving, we're all working collectively to support the student.
Yeah, I love so much of what you all said, and I really, what I'm thinking about is like the shared expertise, both for our interdisciplinary collaboration, but also with the students' expertise on their lives and what they need. And we combine all of those things together, kind of give as much information as we can and promote that agency, as you were saying, Barb, to help them to make the decisions that are best for them. So love hearing all of that. Hearing you all speak just makes me even more excited and thankful for the relationship that we have and the resources that you offer. So thinking about how big of a part of your job really mental health is, we're curious to hear some of your opinions and perspectives on what ways Dartmouth could do things differently, or health service could do things differently to better support our students' mental health.
I think I'll just jump in. I think Dartmouth in general is doing a really great job, but we could even do a better job of sort of prevention, providing education up front. This is a passion of mine, but I feel very strongly about things like mindfulness. And I think if that were taught to every child very young, all the way through the educational process, and have it become just part of what we do, we would probably really help ourselves and each other.
I just wanted to add one thing, Barbara. Did I interrupt you, or were you in the middle of a thought?
I was in the middle of a thought. Go for it.
Okay, sorry.
No.
Something that I feel is really important, and I think counseling services is working on, and I think we do too, is demystifying and normalizing mental health, right? And I think we can do better. I think we can do that better. We can't take the head off and from the rest of the body. Okay, it's the whole body. And it's the brain, it's the emotions, and everything. And it's normal. Just like you may get a sore throat, you're going to go through periods of getting depressed or being sad. That's normal. It doesn't mean you're weak. It's just as normal as any other aspect of your life. And there's absolutely nothing abnormal, weak about seeking support from counseling, from getting medication to help you through a hard time. It's the way it should be. And I think that even having us separated, I wish, you know what, I wish every other office was, you know, Alex, I wish Holly was on one side, you were on the other, and Kay was down the way. I wish that we were all in one giant commune singing Kumbaya, because that's what it is. You can't, we are all so, we need to be integrated. And that's a hard thing to do. I mean, and that's a hard thing to do with the way systems are set up, but that would be my dream, really.
And I would, if I may add to that, Mary Lee, I think you make a really good point about not feeling bad about feeling sad or anxious. And I think, especially in institutions of higher education, showing and feeling vulnerable is really tough. And to allow for that in whatever way the school can promote the idea that it's okay to be vulnerable, I think is important. I also think as a provider, it's something that I'm interested in and don't know nearly enough about, but I wonder if it were more ubiquitous in our toolbox, back to Mary Lee's toolbox analogy, is cognitive behavioral therapy and dialectic behavioral therapy. I think are really good mechanisms by which we can also help students that they are engaged in the process. It's not just take a pill. It's that they are really working with you. And again, it's about agency. Right?
I think that is the one place where I know Dartmouth is committed to fostering this world-class education and creating leaders, and I know that they want students to walk across the podium after their undergraduate career and have achieved very much. But from a primary care standpoint, our most important goal is for those people to be well. And so if there was a way that Dartmouth could make sure that that was first and foremost, we want these humans to be well. And that's our goal. And then hopefully all those other things happen too, to some degree, but really we want to feel well.
Yeah. Which is sometimes in conflict with the achievement orientation that kind of is so present in higher education, or in education broadly, but in the Ivy Leagues, I think even more so. Not always in conflict. A lot of times everything works together. When we're well, we're being our best selves and achieving as best we can. But sometimes what that translates to, the demands, you know, not sleeping so that you can study is a really easy example, right? It's not, that's not really going to be beneficial to people overall.
Yeah, absolutely. And we appreciate all of your ideas and perspectives, and we'll send them up the chain of command so that, you know, on graduation day we can have students not just surviving but thriving, which I know counseling, primary care, we got it, we get it. Before we shift gears totally and give our listeners what I'm sure they are sticking around to hear, which is the COVID sneak peek, we just want to give everyone who comes on an opportunity to talk about any programs, initiatives, services. This is sort of like a plug your department opportunity. So I don't know, I know we heard sort of what you do and it is vast and comprehensive, but if there's anything that we haven't touched on, or there are projects or initiatives going on that students should know about, now's the time, and don't be shy, like plug away.
Well, I'll plug a recent project that I'm involved in that Dick's House is being very supportive of, which is sort of a health-related podcast. So we're podcasting in tandem with you. I'm working on it with a medical student, and probably somewhat different in that our sort of mission is to talk to individuals who rarely get heard about subjects that rarely get spoken about. And so that's been really fun, but ultimately something we'd like people to listen to that hopefully will give them different kinds of insight.
Awesome. And what's the name of your podcast for our listeners?
The Floor is Yours.
And you can find that on Spotify and on Apple Podcasts, right?
Yes.
Awesome. Thank you.
Thank you.
Anything else you all want to plug?
You know, prior to COVID, we did a lot more outreach, you know, and things have changed a little bit.
Yeah.
So hopefully we can circle back around and have another Thinks with Shrinks after we're past this whole quarantine period. And we can talk about and maybe get some opinions back on the students and what they would like to see from us.
Yeah, love that. Yeah, I know there's so much that you all generally do. You go out into the communities and really meet students where they're at, which is a lot harder when there are very few students here and we're not allowed to be in contact with one another. So
it makes it kind of hard to go into somebody's frat house or or take blood pressures at FOCO. Those are all things that we love doing, because I think that it's really hard to connect with somebody in an artificial environment such as an office. As nice and as welcoming as we try to be, people are a lot more open to sharing what's really going on with them when they are in the position of power.
Yeah.
Right? It's a power gradient change. It's hard to come into a healthcare center.
Totally.
And as much as I think all of us try to allow our patients, our students to really drive the conversation, it's hard. It's hard. I really look forward to the day when we can go back and kind of meet you, the students, where you guys are, and hang out in your living room and answer your questions there.
Yeah. But until then, where we'll be seeing people is in the COVID tent. So I guess.
What a transition. Love it.
That was seamless.
Yeah.
Yeah, you will be seeing people from, hopefully if you're in
distance.
line, you are at a distance, right? We don't want crowds of people. We don't want the line backing up. It is fun. We want to bring you under the tent, but try to maintain a little space on your way.
Yes. Yeah. Well, so with that transition, I guess if maybe Holly, since you kind of started, if you want to take our audience through what does it look like? They'll have the information about what days they're coming and stuff like that. But once they get here, what does that look like? What can they expect when they come to get tested?
Right. So for the mass screening under the tent, this is screening for people who are asymptomatic and just need to be tested to confirm that they are COVID free. And the testings will happen a couple of times within the first week that they're here, a few times over those first 7 to 10 days-ish. And so there's a big tent in the Maynard parking lot, which is the parking lot right outside of the health service. And the testing is offered throughout the day. As more students arrive to campus, the testing hours will expand. And there is no appointment necessary at this time. I will say that things change daily, if not hourly. So we adjust our schedule and we adjust our recommendations and our guidance to students. But what you all receive will be the most up-to-date recommendations about when and how to present to the parking lot. And then you'll see a big tent, and we recommend that people maintain spacing while in line. There will be a series of questions that you will be asked, and you need to meet those criteria to engage in this type of screening test. If you are someone who is worried because you've had symptoms or you've been exposed to someone you know has been sick, then you should call us, and one of the providers will talk with you about how to get tested in that case. For everybody else coming under the tent, you will make sure that we have your correct name and email address, because that is how the results will get back to you. There are often some little issues with not having exactly the right email, and so you don't get your results. We will get your results, and if you hear nothing from us, you can assume that they are normal. But we register students, and then you are given a short Q-tip, and you will swab your own nostrils. And you will swab each nostril 4 times around for a total of 10 seconds, and then the other one, and then put it into a little test tube. And then we send those out every single day, and we get your results within 24 to 72 hours. And they go directly to you. And occasionally we get results that we get a message that a test was not performed for whatever reason. Everyone has to blow their nose before they do their own swabs to clear out any kind of nasal drainage. If there's too much drainage, they won't perform the test. So this does happen. Occasionally we ask students to come back to repeat and to have a second test because one was not performed. And then we'll see students again, and there'll be directions. If this is your first day of testing, this is what you do. And once you've done it once, then you'll get kind of familiar with it. If this is your day 3 testing, you don't need to get a goodie bag. You already got one 3 days ago. And then we direct people through the tent and out, and then you're done. It's relatively.
Not a goodie bag.
I was just gonna say, like that was, I mean, super helpful, and I know students have been curious. So now we know. I didn't get a goodie bag, and I went through this process. So I will attest to it is easy, it is organized, it is relatively painless. But the goodie bag, inconsistent goodie bag giving. Awesome. Thank you so much for that insight and for demystifying that part of the process. We're going to start to wind things down a bit. So I know you know this as avid listeners of Thinks with Shrinks, but we end every episode with a tagline that's "You can do hard things." And then one of my personal favorite parts of it is that when we have guests on, we ask everyone, what is that phrase, "You can do hard things," mean to you? And so I see Holly's thinking. Barb, you look ready. Let's start with you on this.
Oh, you start with me. So my hard thing right now is I'm going for swimming a mile.
Wow.
Yeah, I have found that something that I never thought would appeal to me, because I like exercise so I can be outside, is swimming laps has become something that I'm really enjoying. And so my goal, I'm almost there, but my goal is a mile.
How many laps is a mile?
So I've learned this just recently. So a lap is 2 lengths of the pool that I go to.
Okay.
And it's 66 lengths.
Whoa. That's a lot of laps and lengths.
I've gotten up to 50. So I'm not quite there yet. But
that's awesome though.
Yeah.
Congrats.
Yeah, awesome.
What stroke? Do you like switch it up, or do you just stick with one?
I do primarily freestyle.
Okay.
But I also do a little bit of breaststroke because I think that helps with my my hips, my hip flexors.
Good for you.
Yeah, we'll have to have you back on when you can say that it's no longer a hard thing because you've already done it.
There you go.
So congratulations, early congratulations. Mary Lee, what do you got for us?
Well, I mean, I can do hard. I think that's a perspective. No, I mean, I don't mean to be all esoteric, but
we love esoteric.
There are no hard things, just a bad attitude.
Esoteric is my hard thing.
There are days I think things are hard, but they're not really hard. It's just in my head. I need to talk to one of my shrinks to help me reset my attitude. Because there really are no big deals. They're just no big deals.
Okay. I love that. I love that. We haven't heard that perspective, but it's nice. It fits sort of into it's in the eye of the beholder or the beer holder.
We don't do that here. It's not getting out.
I wish you had gone last, because now you make me feel like the thing that I'm going to say that I think is hard isn't hard.
There are hard things. There are hard things.
We want to hear.
There are 2 psychologists on this call. We're going to validate you, Holly. You know that. Just, if it's hard for you, of course it is.
Okay. Gosh, I feel like there are a lot of hard things. Mary Lee, we need to come. I need to be down the hall from you again because I feel like there's a million hard things. But the thing I was going to say is that I've been really into kayaking with my kids this summer, which is hard because I have 3 girls. They're 8, 5, and 2. And the 5-year-old and the 2-year-old are not strong swimmers. So I'm afraid we're going to tip over. So I felt really proud that I got them all into a kayak and we stayed upright. It was hard.
That's awesome.
We did it. And we just gave the 2-year-old trail mix. Mostly she picked out the M&Ms and that kept
Me
everybody
too.
in the kayak and seated. And we were able to go. We've done this a few times and I feel like I'm not as nervous about it, which is probably dangerous. I probably still should be sort of nervous, but everybody has a life jacket on. I'm just like, how is it going to go when we do flip?
Yeah. Well,
I will
That's
say
hard
one thing
emotionally.
hard. Can I say one more thing?
Oh, you're gonna walk it back?
I am. It's hard not being with my work friends the way it used to be. And it is perspective, and there is a lot of silver linings, but it is hard. Change is hard. And I think we have to acknowledge that sometimes all of this has been kind of hard.
definitely.
Sorry.
No, that's good. It's real. That's it's all of that. I appreciate so much you all being here with us today, and I really appreciate hearing from you about your experiences with mental health. And as we have both, MK and I have both said, we appreciate you all so much and the support that you offer to our students. But yeah, I think we'll wrap up there.
Likewise.
Thanks so much for taking the time.
Rocking.
All right. Thank
All right.
you.
Take care.
That's our episode for today. We hope you join us next time for episode 10 on Friday, September 4th.
And until then, as always, remember, you can do hard things.